Osteopetrosis is a rare hereditary bone disorder that makes bones dense and more prone to breakage. It is a congenital condition. This means people are born with it. There are two major forms of osteopetrosis. There is autosomal recessive osteopetrosis and autosomal dominant osteopetrosis. Autosomal recessive osteopetrosis is the rarer form. It occurs in an estimated amount of 1 in 250,000 people. This form of osteopetrosis only occurs in children. It occurs when the child inherits a copy of the defective gene from both parents. Autosomal dominant osteopetrosis is definitely the most common form of the disorder. It affects about 1 in every 20,000 people. Autosomal dominant osteopetrosis is commonly found in adults, and most people inherit the condition usually just from one affected parent. However, some cases of osteopetrosis do not fit into the either two categories. Scientists decided to come up with a third type called intermediate osteopetrosis. This affects children at the age of 10 and younger and is more severe than autosomal dominant but less severe than autosomal recessive. The symptoms of osteopetrosis vary between the different levels or classifications. However, the most common symptoms are bone fractures, low blood cell levels, impaired vision or loss and hearing, and/or dental problems related to infections. Due to fewer blood cells that are being made, this can cause complications such as anemia, different bleeding problems, and many infections due to low white blood cells. Bone fractures, particularly in the spine or hip, are considered the most serious complications of osteopetrosis. Although you may not have fallen, spinal fractures still can occur. Your vertebrae can be weakened to the point at which it may crumble. This can result in back pain, short stature, and a hunched forward posture. As being shown in these x-rays, when being diagnosed with osteopetrosis, the bones in people appear usually to be more dense and chalky white.